West U Wellness fans. It's Dr. Yeager again. I'm here to talk today about EMS versus TENS. And even for me, it was confusing for a long time. Like, what are they? Why are they different? How do you use them? And so what EMS stands for is electrical muscle stimulation, and it's good for helping to contract muscles. Some athletes use it to help build muscles, but here at West U Wellness, we use them to help relax our muscles and kind of rehab our patients to get those muscles to basically calm down and heal. And then the TENS unit, which stands for transcutaneous electrical nerve stimulation. And what that means basically is you put it on the skin, sends a nerve signal into the tissue, and basically the impulse is telling the body not to feel pain. So TENS is a good thing for helping to relieve pain. A lot of people use the TENS machine to help them with chronic or acute conditions, and in that case they may not have to take pain medication, and they can just hook themselves up to a TENS unit to help relieve that pain. Good conditions that are helped by the TENS unit are backaches, arthritis, carpal tunnel syndrome, things of that nature. So basically it's kind of telling the body not to feel the pain by using the electric current, where the muscle stim, the EMS, is actually causing the muscles to contract and build up those muscles. Unfortunately, I don't have an EMS unit. We've sold out of those, but I do have a TENS unit here. And I'm going to open that up, and you can see what it looks like. It comes with an instruction manual, so make sure you read that thoroughly. And then also, this is the TENS unit itself, and it has a little belt clip on the back, so you can wear it, as you're going through your day. This is either you wear it at home or at work. And these are the electrodes. And then so what happens here is you just snap into place, and you got basically two channels on one line and another two channels. So you have well, two channels, but 2 lines per channel. So you got 4 channels. 4 lines per channel, sorry, confusing. This here is the intensity. So basically you click on this, and it ramps up the electrical impulse. And one side controls one, and the other controls the other side. So that's what the TENS unit, how to set that up. And then there's the pads, and those basically are little sticky things. And they'll look like this. And again, you get 4 of those. And what you'll do is you'll plug these in and make sure that all the metal is completely covered. You don't want that exposed, or it could possibly shock you. So make sure you get all that done. And there you go. So you set those up. And then what I would do, I don't want to waste these pads, but what I'll do is you take these off and you put them on the skin. So when you're applying these, you'll make sure your skin is nice and dry and clean, and make sure you have a good contact. A little hair here, it should still work, but if you're really a lot more hairy than this, then you might want to think about, if you're using it in the same spot all the time, actually have to shade down that spot or trim it to get a good connection for your pads. The pads placement, it all depends on where you have problems. A lot of times people will just put where they're having the pain, surround that area, and that can help deaden that pain area. That's the TENS unit. And pretending that it is an EMS unit, what you'll do is basically put it along the muscle belly and trying to get that muscle to work and contract. Okay, so that's the difference between a TENS and an EMS unit. So, any questions? No? All right. Just a reminder, we are open for acute emergency situations. If you're having those kind of problems here, we can help you at West U Wellness. And I think, a little hint maybe, might start massages next week if you're medically necessarily needing one. So we'll be posting more of that, but just a little shout out there, maybe. So get excited. All right, have a great day.